Hello, everyone. I am Kaveh Khoshnood, Associate Professor at Yale School of Public Health, and I'm pleased to be giving you a presentation today about ethical considerations for conducting HIV/AIDS research in midst of a pandemic, and also more broadly in humanitarian crisis setting. I'd like to acknowledge my two wonderful students, Winnie Ho and Jax Jin, who helped me put together this presentation. I also like to acknowledge CIRA, or Center for Interdisciplinary Research on AIDS at Yale University, as well as the Macmillan Center, who are supporting my ethics of HIV/AIDS research work. My interest in HIV/AIDS research goes back to early 2000, where we were involved in a study of risk of HIV infection among people injecting drugs who have different levels of access to clean syringes. As you can imagine, even though the study was approved by the IRB, there were still a number of ethical challenges that we faced that frankly we were not fully prepared for. So we ended up writing a paper about this, and I learned a lot from that particular experience and have continued my interest in ethics of HIV/AIDS research, and more broadly, ethics of conducting research with vulnerable population, and particularly in humanitarian settings. Last month, we did a workshop at CIRA on ethical considerations for HIV/AIDS research in humanitarian setting. We had a particular focus on conducting research with immigrant workers who are involved in sex work, who've also gone through humanitarian crises in their own country. And we learned a lot from that workshop. When we think about humanitarian settings and ethics of conducting research, there is increasing attention being paid to this topic. This is a systematic review that was published in 2020 that really goes over ethical issues of conducting research in humanitarian settings. And I'll briefly mention this to you. As you know, there's been a rise in humanitarian crisis, which is really put into two broad categories. What we call human-made crises or disasters and natural disasters, such as hurricanes, floods, etc. These crises are affecting millions and millions of population worldwide. A large number of people have been displaced. They become refugees. With the situation in Ukraine, these numbers have expanded. Now there's over 100 million people who've been displaced. In terms of the humanitarian response, there has been a professional growth in the humanitarian response since World War II. These large humanitarian organizations are interested in doing evidence-based interventions, so they're really interested in research being conducted in humanitarian settings that they can but ethical issues come up when you're conducting research in humanitarian setting, and that systematic review came up with 10 different ethical topics that come up when you look at the literature. And I've just highlighted a few of them. As you can imagine, ethical review process could be take a long time, and if you're trying to kind of do a research quickly at a crisis setting, the IRB process could be quite challenging. Community engagement is absolutely key. Investigators need to be involved with the community. Dual imperative, the idea that the purpose of the research cannot just be for scholarly work and publishing results. There also needs to be practical implications to benefit the people who were being affected by humanitarian crisis. I also highlighted risks to researchers because that is, I would say, a relatively neglected topic. When we think about risks associated with humanitarian research, we are thinking about the study population, which of course is appropriate, but the researchers themselves could also be at high risk, whether they're doing research in a COVID setting or some other humanitarian setting. It's not something that should be ignored. Now, switching to HIV prevention research and how COVID has created some ethical challenges, there's a number of papers that I came across. I'm going to briefly go over 5 papers. This first paper, talking about HIV prevention research in COVID-19, putting ethics guidance to the test, talks about these 6 kind of short and long-term ethical consideration in HIV prevention trial network guidance document. The first one is risk mitigation. HIV prevention should be designed to minimize risk, maximize benefits while remaining scientifically sound. This includes calculating the physical, psychological, legal, social, and economic risk for participants. However, shifting to virtual research, as was done during COVID, introduces new challenges for different kinds of research, and there may be trade-offs between reducing physical risk, such as risk of reducing transmission of COVID-19, but increasing other risks, for example, risks inherent in conducting sensitive research solely over digital platforms, or bias against those who don't have consistent internet access, and a loss to study validity. Also, it is critical to understand economic and other incentives to participating in research, since participating in research may provide some compensation, access to healthcare, etc. And we need to consider coercive risk environment should also accommodate participant views as necessary. In terms of behavioral change, COVID-19 compounds ongoing humanitarian crisis situations and may further lead to behavioral changes among participants. For example, disruption to global supply chains may lead to different access to certain kinds of drugs, or differences in personal use, or the stress of isolation may change coping behaviors that may or may not increase HIV acquisition risk. Researchers can't make assumptions about participant behaviors during COVID-19, for example, can't assume participants will stop engaging in sexual activity and therefore don't need to closely monitor adherence to PrEP or contraceptive use. Compounding vulnerability, COVID-19 disproportionately impacts those who have already been systemically and disproportionately disadvantaged. Working with community members to identify key vulnerability factors can be key. And this includes also ensuring the safety of community members that are facilitating your research and not just the research participant. Community engagement that came up again. This includes consideration for how research and engagement is conducted to ensure safety for everyone. It also means addressing everyone's bandwidth for engagement, which may have greatly shifted given the demands brought on by COVID-19. It's critical to understand that even as research pauses, community engagement doesn't necessarily pause. It may need to be redirected. All participants and community members deserve to be informed and included in the decision-making process, even if little or no data collection is taking place. Trial reopening. Most currently paused HIV clinical trials eventually need to reopen, as many seek to answer critical questions for prevention and treatment. There needs to be a balance between preserving research validity and transmission risk, and should take into account local and state guidelines, as well as the wishes of the community. There should not be an assumption that things will be so-called back to normal. Consideration for in-person gatherings should be redesigned to be safe, and the new risk of transmission must be communicated as part of the informed consent. The re-emphasis of voluntary participation and right to withdrawal should be communicated. Should the study be terminated, this must also be made clear. In terms of shifting research priorities, if research is not responsive to local priorities, then we fail to account for host community benefit, which violates research ethics. This includes recognizing that HIV prevention may not be the most pressing local health priority, but that does not diminish its importance or the urgency in which it must still carry on, albeit in different ways. It's critical to recognize the ways in which COVID-19 and HIV can impact each other and to not deprioritize one for the sake of the other, although they're not mutually exclusive. The second paper that I came across is where the authors expound on the inherent ethical dilemma of preserving the health and safety of people living with HIV during the COVID-19 pandemic whilst adhering to the commitment of pursuing long-term therapies. This paper discusses the context where ART is used to control HIV replication, enables immune recovery, limits the risk of onward viral transmission, but requires lifelong adherence. The viral rebound upon stopping ART through the risk of viral rebound is not accurately predicted, therefore ATI protocols are needed. ATI protocols include clinical, ethical, and practical evaluation, including regular HIV viral load measurements to determine risk mitigation of individuals with HIV and their sexual partners. There are greater challenges of maintaining ATI protocols with limitations of travel and social physical distancing. There's ethical debate about indefinite deferral versus careful resumption of HIV ATI cure studies while pandemic continues. One option is to stop all HIV trials, including ATI, until the pandemic goes away. There's case-by-case evaluation of HIV patients. Should HIV cure and ATI trials continue, individuals would need to be evaluated on a case-by-case basis, as there will be changes to patient information and informed consent due to implication of COVID-19. Another consideration due to COVID-19 pandemic is preservation of trial scientific integrity to generate meaningful data. Exclusion of participants to mitigate HIV COVID-19 risk might compromise trial rigor and undermine values of research. The challenges and risk of reopening HIV clinical trials include the realities that need to be faced. Participants that need to reinitiate ART because of COVID-19 infection, exposure. Studies need to be redesigned to measurements of immune responses that could be affected by COVID-19 implications. Risks associated with taking part into a clinical trial requires additional hospital visits, which may increase chances of getting infected by COVID-19. The risks of increased susceptibility to COVID-19 associated with ATI. Risk of worse clinical outcomes from COVID-19 disease. Risk of worse outcomes of the ATIs, and risk of disruption to ART availability. The conclusion in that study is to preserve the health and safety of people living with HIV while balancing the global commitment to pursue long-term HIV therapies through, though ethical considerations and risks must be considered within the context of the pandemic. This next paper highlights the key research challenges experienced by participants and the research team members and highlights the way in which COVID-19 disrupted not just the research study, but also the provision of services for the participants. This is a qualitative study, and the key themes that arose from participant experiences include challenges in accessing care and prevention services, fear of co-infection and negative experiences at facilities, limited psychosocial support, after testing or initiating PrEP, and misinformation, false information about COVID-19 that impacted their decision regarding HIV services and treatment initiation. Those that tested HIV negative were especially concerned about participating because they saw less need to put themselves at greater risk of exposure if they had already tested negative. Among those who tested positive for the first time, some were still in denial and lacked psychosocial support and resources to initiate and cope with treatment. This next paper on public health morality, sex and COVID-19, sexual minority men's HIV pre-exposure prophylaxis, decision-making during, this is in Ontario's first COVID-19 lockdown. This paper is about how to frame public health message, but it is a great example that points out the key fact that participants themselves are also renegotiating their personal ethics. Public health morality and ethics are shaped by a wide breadth of factors, and especially during COVID-19, with ever-shifting, increasing politicized, and repeatedly negotiated en masse. This paper also brings up the point that as a population already under the microscope, subject to stigma and perception of their morality and ethics, there is a responsibility of researchers to understand the weight of how they contribute to discourse on these populations, and that in pursuing ethical action, it is critical that we don't further engage in public shaming that can further increase stigmatization and pathologization of communities. The last paper is focused on lessons we've learned from HIV/AIDS research that can actually shed a light on how we can balance tension between COVID-19, public health response, and stigma mitigation. This paper reminds us that as we face this new unprecedented global challenge, our approach to understanding and ethically navigating COVID-19 has been deeply informed by the efforts to improve HIV/AIDS research ethics. The response to COVID-19, while in some key ways are different than our historical and current response to the HIV/AIDS pandemic, echoes many key ethical considerations that can deepen and complicate existing ethical considerations for vulnerable populations. We see parallel trends of misinformation, fear, stigma, concerns on how to navigate physical and social proximity, xenophobia, and racism. I'd like to end by just sharing this literature list and citations. And I want to thank you for listening to my presentation, and wish you a happy, healthy rest of the day.